Welcome everyone, and thank you for joining us this evening. My name is Peter Waxman, and I am one of the moderators for this evening's webinar, along with Jeanne Tobin. Over the summer, Jeanne and I co-chaired a community task force on the subject of death, dying, and mourning during COVID-19. Together, we examined the challenges that members of the Jewish community face during these difficult times of loss and grief. The task force's goal was to develop recommendations on how we, as a Jewish community, could best support individuals and families who have lost loved ones over the last 7 months, when everything we know about funerals, burials, and Shiva have had to change and shift. One of the recommendations was to host this type of webinar, hear from experts in the field, and share community resources. We are glad to fulfill that recommendation this evening.
Thank you, Pete. Good evening. Since the start of the COVID crisis, the age-old Jewish traditions and rituals, which have always provided comfort and support during this time, are now threatened or prohibited. Visiting the dying at their final moments, gathering for a funeral and burial, returning home to be surrounded by friends, family, and clergy for the very comforting and life-affirming Shiva. And attending bereavement support groups, which help mourners rejoin their communities. All of these are either changed or not available to us at all now. And at the moment of initial grief, the mourner should not have to reinvent these customs. So our community steps in to help navigate the challenges and reduce the obstacles. We're blessed here in Cleveland to have many congregations and clergy who are addressing the concerns of their bereaved congregants. They're all finding methods to ease the way. We hope our work here supports their efforts. The task force intentionally had representation of clergy from the major movements of Judaism and local synagogues. However, some members of our Jewish community are not affiliated with a congregation, or people may have come from out of town to bury a loved one. We know that each Jew is responsible one for the other. As we keep that in mind, we hope this panel tonight provides support for anyone needing help at this difficult time.
We'd also like to take a moment to thank the task force members who worked on this over the summer. Their names are up on your screen. We're also grateful for the support of David Heller, Federation Board Chair, and Erica Rudin-Loria, Federation's President, who encouraged this work. We'd also be remiss if we didn't mention that Federation's annual campaign for Jewish needs has recently launched. With so much uncertainty, your support of the Jewish Federation of Cleveland is vital to our community's continuity and success. Together, we can overcome once-in-a-generation challenges in the near term, while also preparing for the future, sharing our perspectives, and repairing our world in the longer term. Much of our community collaboration, conversation, and support that you'll hear about tonight would not be possible without the dollars raised through the campaign, which supports dozens of local agencies and projects. To support our efforts, we have an incredible match this year. It's called the Mandel Match. Every new or increased gift to the 2021 campaign will create a matching gift in the amount of the new gift or the amount of last year's gift if it's increased. From the Jack and Joseph and Morton Mandel Foundation to Jewish Cleveland's Coronavirus Emergency Relief Fund.
Resources available to all of you if you are faced with the loss of a loved one. We will try to cover most of the urgent topics, but if you have questions or suggestions, we invite you to submit them through the chat feature. The panelists and hosts will be able to see your questions. Now, time permitting, we'll address as many questions as we can tonight. We'll also be recording this session and providing additional resources after the webinar. So now, I'd like to introduce you to the panelists for this program. All of them are so well known and respected in this community. Bart Bookatz is the director of Berkowitz-Kumin-Bookatz Funeral Home. Rabbi Akiva Feinstein is the Director of Spiritual Care and is the hospice chaplain at Montefiore of Menorah Park. Dr. David Rosenberg is the Director of the Ahuja Lung Center, Division of Pulmonary, Critical Care, and Sleep Medicine at University Hospitals. And Cantor Sarah Sager is the Cantor Laureate of Fairmount Temple. Let's start with a question related to families and clergy being able to visit loved ones in their final moments. Rabbi Feinstein and Dr. Rosenberg, will you address some of the challenges you've seen with families wanting to visit loved ones at long-term care facilities and hospitals, and some of the options available right now? And then perhaps Cantor Sager can share how the clergy and chaplains are working with families while not being able to visit them in person. Rabbi Feinstein?
Thank you so much for the opportunity. The policy for places like Montefiore, nursing homes and hospitals is under pretty strict guidance from the state of Ohio. So, for example, right now, we are allowed to have visitors to meet their loved ones outside of the building. But that's contingent upon a place like the nursing home doing testing of the staff and when necessary testing of the residents. And only when we're doing testing and we're making sure of a number of policies being enforced, then can we have the visitation outside. So fortunately, we've been able to keep up a good situation of visiting, and that family members are able to come for a 20-minute visit outside with their loved ones. There's social distancing, and the loved ones typically make a reservation in advance with the facility, and the facility brings the resident outside for the visit. In situations where it's very, very critical, where the patient's condition is changing fast and we're not sure when the family can see them, we are allowing on a limited basis a few visitors to come into the building and to actually spend time at the bedside of the loved one. And also some situations are your Menorah Park campus has a multi-hospice house. And there is a situation where each and every room has a separate entrance. And that has allowed families to come actually outside the patient's room, open the doors, and be within a very close distance to the patient. So that's a good example of how the facility, in conjunction with the laws and the circumstances, can try to make it fit as much as possible.
Thank you, David.
Healthcare systems in Northeastern Ohio understand the importance of end-of-life visits for hospitalized patients. They understand that being denied a few final words, holding hands, a kiss, all can have adverse emotional effects on surviving family members, while negatively impacting the grieving process. Unfortunately, public health concerns in hospitals during the midst of the pandemic have severely restricted visitations, even for those nearing the end of life. At under such circumstances, for non-COVID patients, only 2 designated visitors are allowed, and for COVID patients, it is reduced to 1. Similar type restrictions exist at all the Cleveland healthcare institutions. However, in order to address the negative impact of these required restrictions, the clinic, and Metro have all invested in improved web capabilities to allow efficient connections of personal smart devices in patients' rooms. This will facilitate direct connections between loved ones, so cherished interactions can be remembered. With respect to obviously the institution which I am most familiar with, the updated IT platform with trained staff to help facilitate the process is currently being piloted at Parma Medical Center and should be available at all the facilities, including Ahuja and the Cleveland Medical Center, by the end of the month. While nothing replaces direct person interaction, and web communications are not a perfect solution, these IT upgrades will allow family and friends to share some significant remembered moments with their loved ones. Finally, I would like to add that a very positive policy change has occurred at over the last several weeks. For non-COVID patients, visitation is now permitted by chaplains and clergy. Reestablishing this spiritual care will benefit all patients in the hospital, However, as we all know, it is of paramount importance for those nearing the end of their life. I'm going to now turn the program over to Cantor Sager.
Thank you, David. I think the operative term for clergy is working with our families, because we really are trying to embrace our families in every possible way that is still safe and is thoughtfully done. For example, I have sung to patients over the phone. We will do FaceTime. We will do Zoom, depending on who is available from the family, usually, to set up something like that. I have done vidui, the final confession, over the phone. And especially if there's a family member present touching the patient or holding a hand, it can be very effective and very meaningful. And again, it depends on what state the actual patient is in, as to where in the spectrum of comfort this falls for that individual. Once a death occurs, we embrace the family in every possible way. Sometimes we will sit with the family over Zoom, because none of the family is here in Cleveland. And so we all have to gather technologically. But there have been very meaningful moments that have happened through these compromising means, nevertheless. I believe that our families feel that they are being heard, that they are being attended to, that they are being cared for. And again, at graveside, which is where so far most of the funerals I personally have done, although we have also done some in the Berkowitz-Kumin Chapel, but and there will be more going forward into the colder months. Even with distancing, I think there is a sense of connection, because we are all trying to bridge that divide. There have been moments I officiated alone at the Mayfield Cemetery Mausoleum with just, actually it was Stuart Berkowitz who was present. Just the two of us were there, because the family actually were not in town and were too far away to drive in, and flying was just not advised. So there are many, and now there are some situations where our physical presence can be done safely, but we have to be careful. And I don't want to, give a blanket, we will show up, whatever. I think we are working with our families and trying to embrace their needs and embrace them in every possible available way.
Thank you. Our next question is for Bart. Once a loved one has died, what are the funeral and burial options available at your funeral home right now?
Thank you. This new normal has changed the way we observe our customs and traditions. From who may be with the person who is dying, the attendance and place of the funeral service, and our Shiva customs, observance, and how we support the mourner through this process. Where the person is dying determines who can be with them, and the procedures for being with this loved one. Dr. Rosenberg and Rabbi Akiva has informed us of some of the procedures and requirements. Arrangements with the funeral home can be done in person, virtual, or over the phone. This is for you, the family, who has that option. It is whatever makes you comfortable. Funeral services under COVID-19 are being either held at the graveside, in our small chapel with a limit of 15, or a large chapel which has a limit of 45 people. If it's a graveside service, the family can Zoom the service, with the funeral home being the host, video the service, which later can be uploaded to our dedicated channel for people to view, or being held in our chapel, which offers live streaming if they wish. There is currently only one synagogue that is offering their chapel facilities for a funeral service, and that has a limit of 25 people. As we begin to enter fall and winter, I expect people will select our chapel for more services to be held. They're due to weather constraints. At the graveside service, a public address system is set up so people attending can social distance and still hear and be part of that funeral service. Each cemetery has its own restrictions on the number of people that can attend that graveside service. If death occurs in an institution where the family is limited in numbers, the funeral home will make arrangements for a family to be able to come in before the service, and if they wish, spend time with the deceased, giving them the opportunity to pray with that deceased, say whatever they wish to the deceased, or just be with them, giving the mourners a time of comfort. Shiva was meant as a way to allow mourners, family members, and friends to gather, to offer support to the mourner, to pay their respects to the family, and to reminisce about the deceased, giving them all a time to reflect and pay tribute to a life lost. Very seldom under this new normal are we able to show support by giving the mourner a warming hug or just the feel of a well-intended touch or a shoulder or a hand, a feeling of support or comfort that is lost. Some families choose Shiva observances to be private, some by Zoom, some in their backyards or drive-by Shivas. The funeral director can explain to you your options, and it's your choice of how you wish to observe Shiva. The funeral home will supply the prayer books, Shiva stools, folding chairs, coat racks, and after each use, we properly clean all equipment, and we have enough stock of these items to also rotate their use. People who feel not comfortable with the actual Shiva can send condolences through our website, send a card, make a donation of deceased memory, or even call and express their thoughts and prayers. If you wish to send food to a home of Shiva, please contact the family before. Due to COVID, many families are not accepting food items from outside, not knowing how they were prepared and by whom and how it is being handled.
Thank you, Bart. Thank you, everyone, for those helpful responses. Bart has covered some of this next question, but I think there's more to be added. Can you tell us how families can safely gather for funerals in Shiva? We know that the recommendations from the CDC, the Ohio Department of Health, and our County Board of Health have changed and evolved over the course of this pandemic. What can families do as of today in order to be comforted by their friends and community, but with the lowest risk to everyone's health and safety? Dr. Rosenberg?
Sure. From a public health perspective, various parameters are followed for gauging community risk of contracting COVID-19. One critically important measurement is the number of new COVID cases per 100,000 individuals. Minimal risks exist when this figure is less than 1. Moderate risk when it is 1 to less than 4. Substantial risk when it is 4 to less than 7. And widespread risk greater than 7. Current population statistics for Ohio generally place this figure at 7.9, and specific to Cuyahoga County, it is 5. There clearly has been a positive downward trend in this parameter since July, but based on the current level of COVID in our community, the health department still recommends that general gatherings be limited to 10 individuals. While faith-based services are exempt from this restriction, unfortunately, the coronavirus has no respect for a person's religious convictions. Hence, one needs to use some common sense approach to limiting the number of persons congregating, even for those gatherings surrounding the death of a loved one. Also, other general mitigation guidelines should be followed, including masking and social distancing, with special attention made for adequate ventilation, preferably with a lot of outside fresh air. In addition, it is imperative for hand hygiene to be encouraged and the cleaning of common contact surfaces. Also, sharing of common objects, such as a prayer book, can spread infection. In addition, one should appreciate that singing and chanting can be associated with the aerosolization of small viral particles. making certain individuals called super spreaders of COVID. Finally, it is recommended that anyone who is sick with a potential COVID-related symptom or symptom complex should not attend any type of group interaction. The question then remains, with all the restrictions surrounding gatherings, what are the options for how families suffering a loss can be comforted by friends and community? Unfortunately, there are a variety of possibilities to achieve the desired goals, which Bart will address. However, before he does so, I just want to emphasize, except for the virtual and drive-by options, COVID risks cannot be eliminated. It only can be mitigated. Total safety cannot be guaranteed in a group situation. With this in mind, special attention has to be given to those who are older and or with comorbidities. For them, one needs to pay special attention to all the principles for minimizing COVID risk, which I've outlined. Also, such individuals, if attending an in-person gathering, probably should be wearing a face shield in addition to a mask. I'm now going to turn it over to Bart.
Thank you, David. As David explained, it is very important to maintain social distancing and to wear a facial mask. At funerals, we strongly encourage this. In fact, it is with the clergy's help that no person will be allowed to attend a service without wearing a mask. We encourage everyone who is attending a funeral to abide by the social distancing. And again, as I mentioned before, we are currently doing mostly graveside services. We're in the outdoors. We have the PA system, but we encourage families not to invite outsiders. It's important that we all realize what a terrible pandemic that we're in. And unfortunately, during these times of grief, we look to others for strength. We now must be able to look within ourselves for that strength and also to lean more on our immediate family for that strength. Thank you, David.
Sarah, can you share some thoughts about Shiva and what you've observed?
Thank you, Jeannie. Absolutely. I would just say in general that we are an extraordinarily resilient people. And in addition, we are resourceful and we are creative. And the distance we have traveled since last March, let us say, when these things first started snowballing, to now is enormous. Part of it is our attitude. Most of us are prepared. If someone is dying, we know that there are going to be limitations. But within those limitations, we have discovered ways of dealing, as we always have. And some of it's inspiring. Even, I mean, these are the small, I call them the small silver linings. One would never, ever want a pandemic to find them. But we have come up with some wonderful possibilities. So you have heard about Shiva. Shiva is one of those things. It's so frustrating to go back to an empty house and not to have your community present. It has become technologically a remarkable event. I have been present at Shivas where people have gathered on Zoom, and each person has been given an opportunity to say something. And the silver lining there has been that everybody present, it participates in hearing what is being said about the deceased along with the family members. I was a part of a Shiva that there was either a family member or a friend who was very technologically savvy, created time slots for every person to arrive because they expected a lot of people. It was, and the family said after, you know, it was so special to be able to hear each individual's recollection of my loved one, because in a house of Shiva, sometimes things can get quite intense and busy and lots of people, and there's interruptions and there's all kinds of things going on. So those Shiva experiences have really been very comforting. They've been comforting and even satisfying. I will share with you a ritual that I heard about, and I don't believe it's happened here yet in Cleveland, but it did take place in Texas early on, actually. A renowned member of the community passed away, and the community was just so frustrated at not being able to be present. And they did the following. They asked the family when they left the cemetery to drive back to the parking lot of the synagogue. And in that synagogue, everyone gathered in their cars, in parking spaces that they separated by stands, by the orange stands, so that every other parking space was empty, and the cars faced into the parking lot, so that on either side the cars would be facing each other. They turned on their lights, and the cars with the family drove through these automobile or these car aisles of consolation. I am just, I'm overwhelmed with such thoughtfulness and such creativity, and new things are evolving every day in this way. Again, we are all waiting to be able to gather in person, but in the absence of that, we are sending out constant reminders that we are present, and we are doing it by phone and by text and by computer and carrier pigeon. I mean, it's just in every possible way.
I could just add on for a second to what Sarah said so beautifully about our people's creativity and their ingenuity in the face of difficulty. A family member had told me recently how someone wanted to comfort them during Shiva, and they weren't sure how. There were a lot of limitations, and they just felt they couldn't speak on Zoom and make do with 2 minutes just to tell the story of this person who had passed away. So they actually secretly went behind the scenes and gathered pictures and stories and quotations from the person who passed away, and they made like a special scrapbook, an online scrapbook, and they dedicated it to the deceased person, and they basically presented it to the family at the time of a Shiva as a gift, on behalf of the beloved friends. And the second quick thing that I was going to say also is that recently Rabbi Kutner, blessed memory, the Rabbi Menor Park passed away. And there was a question immediately, how can lots of different people in different places, honor him, in his final day. And they decided what they would do is they would take the hearse at one of the home-based synagogues in University Heights, and they would have a bunch of people talking a little bit at the driveway, and then it would go from basically street to street in University Heights and let people who are standing on the sidewalks give a chance to honor and to escort. But it allowed social distancing, it allowed people to be placed far apart. And then finally, when they got to the cemetery, everyone had agreed none of them would go to the cemetery except for the key people. And it was an amazing way that a community could say goodbye to its rabbi and adhere to all the social distancing things, but show tremendous caring and tremendous respect.
Thank you all for those thoughtful insights on how we can still gather for funerals and Shiva. Our next topic covers bereavement and re-entering the community after Shiva and Shloshim. What are the options available to individuals and families at this time? Rabbi Feinstein?
Thank you. For me, it's one of the biggest questions, this question, how can we comfort people and support them after their loss, besides the formalities of Shiva, etc. And this task force that I sat on with many great people, we were dwelling on this question a lot, is that many people are facing losses from COVID itself, how it's affected their businesses, their families, complete life altogether. Then on top of that, the COVID itself has affected how their loved one has gone through illness. It's a hospitalization they weren't able to be part of. Surgical options, chemotherapy options were affected greatly because of COVID. And then finally, as we discussed, the funerals are often very different. The Shivas aren't there. families aren't able to gather in the normal way and support and comfort each other. So a lot of people come into the phase of bereavement or mourning with not just the bereavement of a loved one, of a loss of a person, but it's really a loss that is not ended. You know, it's a pain that continues that they're figuring out on top of the pain of their loved one. And so I think that the clergy and different resources in the community have opened up their doors even wider than before and are well aware of people's needs to not only have bereavement counseling, but to be supported by, you know, in the pain of the pandemic, which continues. So in terms of bereavement support groups, you know, I'll just say really quickly, some people don't know what they are. You know, they have an assumption about them, but really the ideal bereavement support group is not so systematic or formal. The idea is that people get together with somewhat of a leader who encourages, who cheers them, but really what the work of the bereavement group is just sharing and caring and supporting one another. And one of the most effective signs of a bereavement group isn't how much they learn, how much they discuss in the sessions, but it's how that group bonds together and how they in turn support each other thereafter. So I think for a Jewish community, the bereavement support group concept is a very key and very important one. So for a long time now, a lot of the synagogues have offered bereavement support groups. Sometimes it's harder for the smaller synagogues to offer a solid, regular bereavement support group, but there have been times when the smaller synagogues have made them with a loss, when there's been more losses, when there's been more specific issues in the synagogue, and certain bigger ones, like I said, continue to have ones on an ongoing basis. And so for people who are not part of that system, don't have a synagogue support group to go to, places like Vinny Hospice of Montefiore have offered for more than almost 20 years now, a community-focused bereavement support group. And we have tried to gather groups. Generally, we divide them according to people with similar losses. People who have lost a parent are in one group. People who have lost a spouse are in another group. And Miriam Katz has led that group for a long time now and continues to do so. But besides that, we're seeing the need to not only focus on bereavement per se, but like I said, the pandemic losses and bereavement altogether, and how it affects us as a community. And so Vinny Hospice of Montefiore, we're hoping to expand upon our bereavement support group to really affect more people, reach more people, and deal more broadly with the issue of loss of a person and otherwise. There's also very large, organizations like the Cleveland Clinic and university hospitals, which have had very, very successful bereavement groups for a long time. Also the Gathering Place. And that some of those places have very formal groups. You sign up, you're part of the group, and you continue to take part. But many of them have drop-ins where you can just show up once and just see what it's like and see if it's for you. And many of them are also offering music therapy, art therapy, other forms of relaxation and connectivity to help people to deal with bereavement. And it's really kind of much more open than you would think. You can literally go on the web and look at some of these hospitals and find tremendous offerings that you can just sign up for. And it's a difficult world, the world of going through bereavement, but thank goodness we have a lot of great options, and we really hope to improve it even more.
Thank you, panelists. Thank you all for your comments. What we're seeing tonight is this is not just a difficult time for mourners, but it's also difficult for those whom they turn to. The clergy, the doctors, the funeral directors, the social workers. It's hard for all of us. And it's good that we're together to show that we're all in this together. We've covered quite a bit tonight. The pandemic we're dealing with morphs and reinvents itself constantly. And then to make matters even more complicated, we're facing a change of seasons tomorrow. So we have to be agile in adapting our rituals to all the changes. We'd like to take some questions which you've been submitting through the chat. We'll not be able to get to all of them, but we'll do our best to answer as many as we can in our time left. Pete?
Yeah, so we do have a question from a participant in the audience. This question is specifically for Cantor Sager and Dr. Rosenberg. What do we do once the weather changes, and what can we do for Shiva so that we can gather safely and socially distance ourselves outdoors?
With respect to the meeting of gathering of people, I mean, the various mitigation strategies of distancing, masking, and cleaning surfaces and ventilation are critical. The question is, when it gets colder outside and you have to come indoors, you're not going to have adequate ventilation. You know, conceivably, under certain circumstances, if it's not real cold, you could use a heated tent or possibly a garage. But I'd like to ask Cantor Sager, what about specific areas in the community, buildings and synagogues in the community where maybe you could have everything controlled, the right environment, the right cleaning, the right ventilation? Is that possible, Cantor Sager?
Yeah, thank you, David. I will share with you, by the way, just by introduction, that this last winter in January, before all of this started, I did a graveside funeral, and it was not a warm winter day. It was a cold winter day, and there were many people. There was pre-COVID, but it was, I would say, somewhere between 15 and 25 degrees outside. And we gathered under a tent or just outside the tent, and people dressed up very warmly. So that is, it will continue to be an option, except on the most frigid days. However, more to the point, we have at Fairmount Temple, at any rate, that's my experience, we have opened our sanctuary to bot services with the following restrictions. Only 25 people may be present in a room that is built for 800. And they must be socially distanced. And we have worked out a whole choreography where the rabbis and the cantors can be present. The cantor even, further away again because of the singing issue. But we have worked it out, and it is worked so far. It is working. So our sanctuary, depending on scheduling and all of the rest of it, will be available. We have also, in a very limited way, been available to do some Shiva sessions, again, with a limitation on the number of people at any given time. And that's also an issue of scheduling. I will share with you also, so buildings are available. But again, I don't want to say a blanket availability, because again, there are always scheduling and other kinds of considerations. So, but please investigate, because again, we only want to work with our families and find solutions to these things. We want to find them as much as or more than our families want and need them. I will share with you two other practices that I recently learned of, and these have to do with Shiva. In one instance, the week of Shiva, a family member organized a nightly conference call where individuals called in, because I guess Zoom wasn't available or the computer wasn't, whatever it was, it went back to the old-fashioned telephone, and people would call in, and at one point, at a given time, and they would do a who's here by last name, so that alphabetically people would say, they could jump on. And it evolved into not only saying who was there, but then into a recollection of the deceased. I also know of a congregation that has established a, I think it's an 8 o'clock at night, 9 o'clock at night minyan, where volunteers staff it every single night. And every night at that time, they've committed to an entire year. If you want to say Kaddish for a loved one, you call in, and there will be a minyan of people available to say Kaddish with you.
Just as a follow-up to that question, in addition to Shivas and funerals, how will visitations for those who are sick change when the weather changes?
I think that, on behalf of, for example, the nursing home, that's one of the biggest questions we're getting right now is what's going to happen when it's colder. We're thinking of the period that's before us is going to be a little cold. We might be able to cover ourselves with some kind of outdoor heating and outdoor solutions, but that won't get us through the heart of winter. And, I think there's a lot of thoughts going into it, such as, Cantor Sarah said about, using large spaces and sparse amounts of people. But I think one thing that we're also considering is that a lot of our families had been preparing and knowing that this would come. And so their utilization of technology has really, really improved. And, you know, for example, not a week goes past in our facility when we don't get boxes and boxes of Alexas and Echoes and Facebook portals and, you know, all kinds of devices that families are sending our way, you know, and getting those configured, getting those working, you know, so that once the winter time does come, we won't be able to communicate as well, you know, that they'll be able to do that. We did have also window visits at one point, you know, so it might be a consideration that residents could be on the inside where it's warmer, but families might have to endure the cold and be bundled up on the outside, you know, as a way to continue those visits. And also I'll just say, I also think there's a lot of like, you know, onus on the clergy to change the way that they offer services. And, you know, in the nursing home, for example, we can no longer offer services to all the residents. So our response has been to go to the residents. And so for this Rosh Hashanah, we basically arranged a parade, you know, where the cantor and the rabbi went to each and every hallway, had all the residents kind of line up in their doorways, you know, keep some space from one another. And we went up and down the hallways, you know, myself and my colleagues at Menorah Park, singing and dancing and, you know, making a beautiful show for Rosh Hashanah. And I think that's just one example of how, you know, when you can't bring the service to the people, you bring the, you know, you bring people to the service, you bring the service to the people. And so I think that there's tons of creativity. We are a little worried about it, but I think we will have some good solutions.
I would just add to what Rabbi Feinstein and Dr. Rosenberg have said, because they've covered hospitals and nursing homes. There are often times when a person is at home and they are ill or they are on hospice at home. So again, I always want to, I can't give a blanket, we will come by, but given the right circumstances and the right precautions, those visits are possible as well. Again, we will work with the family and work with the individual and the individual's needs.
Thank you, Cantor Sager. You know, you listen to these answers and we think to ourselves, if we had done this webinar a month ago, we'd have a whole different set of answers. So yes, this is definitely a work in process. Another participant question comes in about the use of technology. You know, for some of us before the crisis, the word Zoom meant to magnify or to drive fast. And now it's an entire way to communicate. So perhaps Bart and Rabbi Feinstein and Cantor Sager can address some of the challenges that come with hosting a virtual Shiva over Zoom. How do you do it? Are there best practices and tips for being the Zoom host for an event?
Am I on?
Yeah, Bart.
Oh. We at the funeral home tend to host the Zoom ourselves. This way, the family doesn't have to worry about who's being entered. Everyone is muted, so the service is not disrupted. We do download that service later to our site, so it can be viewed by everyone. Unfortunately, Zoom is not perfect all the time. We have found that at times it freezes. We have found at times that your cell phone or whatever device you're using just doesn't have a strong enough signal. So there are some difficulties, but each day we're learning to overcome these. We ourselves are becoming more technically advanced. It's a challenge, and it will continue to be a challenge because no circumstance is ideal, especially this pandemic isn't ideal. And technology is being thrown at us novice people so fast, we're trying to keep up with it.
I was going to say also, the thing about Zoom is that it's kind of a jungle sometimes because it's technology, but yet it's people. It's real stuff that matters a lot and very sensitive moments, but it's awkward over the phone. You don't really seem to feel the people in the room the same way. And you don't get the same feedback when you talk. So I think one of the biggest pieces of advice I would give to people is, if you're having a Zoom Shiva, is to make a lot of rules. You know, it sounds a little strange, but I think the rules can help and the structure can help a lot. You know, so for example, you know, I know someone recently who has a family that's all over the place, you know, different levels of religiosity. You know, some are very liberal, some are very, you know, very orthodox. And, you know, some are very open about their mind, you know, in their speech, and some are very shy. And so one thing that helped this family very much was that they had a friend who was the go-to. And the obituary just simply said, for Shiva arrangements, call so-and-so. And that you would call this person and he would explain, you know, how the Shiva is going to work and how the Zoom is going to work. And he would explain that you have a minute to prepare something and you'll speak and it's going to be more controlled. And so this situation of having this one go-to person in the family allowed a lot of structure. And you might think it was overdoing it or more than you need, but in a time of such sensitivity where every little comment can either help tremendously or hurt, it proved to be a very, very good investment. You know, so that might be an excellent use of that same friend who wanted to send a Shiva tray, but you can't accept it because it's kind of awkward. Maybe that person will help to arrange the technology for you and make things easier.
I would just add that if a service is happening in the synagogue, we will Zoom that service. However, for most Shiva situations, that we really suggest that some member of the family or a good friend should set that up and be in charge of it. And, you know, there are so many things that people cannot do at this time that when they say, what can we do to help? Well, you take the Zoom, please. That is one of those ways in which family or extended family or friends can be extraordinarily supportive and helpful. And the other thing that we all need to become comfortable doing is, as Rabbi Feinstein kind of indicated, is saying everybody needs to mute. Please mute yourself, because it can become quite cacophonous when there is more than one microphone open, and it just doesn't work that way. I will also share with you, however, that one of the this little silver linings of this time is that families are spending a lot of time and energy putting together montages. I think actually, Rabbi Feinstein, you kind of indicated that when you talked about the scrapbook, but they are putting together montages of pictures and music and videos and sayings and memorials, technological memorials to their loved ones that are then postable in other places as well.
Thank you. Thank you very much. Another question just came in about stone settings. Should families just wait until after COVID and make it like a second funeral? Have just a few people graveside? This question maybe can be answered by Bart and the clergy. Do you have any thoughts on how you're advising your congregants?
If I was to be approached on that subject, I would tell the family this is basically their choice. Stone settings are usually small gatherings to begin with. You don't have stone settings in the winter here in Cleveland. It could be later on. A stone setting could be turned into a celebration of life, because that stone, that monument, represents that person's life, that remembrance of them. So I am not opposed, nor will I discourage a family from, when they having a stone setting, to, if they want to enlarge it to, with the proper help, to have a celebration of life at that same time that they weren't able to have during this COVID time.
Any other thoughts?
I would just acknowledge, I've actually done several stone settings. Originally, when this all started and we were doing these unthinkable funerals that, according to Jewish tradition, we just couldn't quite get our heads around it, our families comforted themselves with saying, when it's time for the stone setting, that's when we'll involve people and we'll all come together. The longer this pandemic has gone on, I think we have come to terms, or some terms at least, with doing the funerals when they need to be done and dealing with the stone settings as they come along. One of the stone settings was larger than the funeral. And not for any good reason, except that that's kind of where those people's minds had gone. But it was outside, and everybody was very spread out. So I would echo what Bart is saying, and I think it is up to each family. But if 3 months later, 6 months later, a year later, you are still feeling a need to have family and friends gather in a more organized way, then wait. There will come a time. I absolutely believe it will come.
All right. I think we have time for one last question from the audience, and we may not have an answer to this at this time, but I'll throw it out there for our panelists. It's, what if someone wants to be buried in Israel?
Oh, I can answer that. I can answer that with no problem. We are transferring people to Israel for burial. They are accepting human remains in Israel as long as there's no COVID involved. The problem that we are facing, though, is the cancellation of air flights and the limited amount of space available in the cargo area for shipment of human remains. But we are currently performing the transfer of remains to Israel for burial.
And to add on to what Bart's saying is that, you know, besides those restrictions, there's obviously when one comes from America to Israel, there's the quarantine requirements, you know, that a person may not just be able to get off the airplane in Israel and attend a funeral service. And so, and vice versa, when one has been to Israel and returns to America, you know, they will also have to quarantine. And often that proves to be impractical. So, you know, so many people I know are making funerals in Israel, but they're not actually making the physical trip themselves to accompany the deceased as they might have.
All right. I think that closes the audience questions. I just want to thank all of you for joining us this evening for this important community conversation. We hope that our panelists were able to share some perspectives and some recommendations that are or will be helpful to you during your time of loss and mourning. Please remember that if you need help, you can always call our Access Jewish Cleveland helpline to be directed to a community resource.
Once again, we thank all our panelists for their advice and participation tonight, as well as the entire task force for their ongoing commitment to this sacred duty. And clearly, from what we heard tonight, we need to continue the task force work to serve our community. Our gratitude also goes to the Federation professional staff for their dedicated support of this effort. We wish you all a happy, sweet, and healthy new year. Gamar Hatima Tova, be well, and good night.